Welcome back to my channel. Today we will be covering Vata Vruddhi and Vata Kshaya from Kriya Sharir. Why does one person become extremely thin despite eating well? Why do tremors, constipation, dryness, insomnia, and joint pain often occur together? According to Ayurveda, all these symptoms can be explained by changes in Vata Dosha. Today we will understand two important conditions like Vata Vruddhi, that is increase of Vata Dosha, and Vata Kshaya, that is decrease of Vata Dosha. We will also discuss their clinical importance, modern correlations. Again, one interesting point mentioned in Ushna Kamita is that doshas mainly undergo two changes: Vata Vruddhi, Pitta Vruddhi, Kapha Vruddhi, or their Kshaya. However, in classical Ayurvedic treatment, it mainly focuses on correcting dosha Vruddhi. Now, why is that? Dosha depletion is comparatively uncommon, and the main reason will be discussed later. Now, Vata Vruddhi. When Vata increases, its natural qualities become excessive. Now, as we can see in the notes, that defects in primary form of Vata dosha occur in two ways, that is Vata Vruddhi and Vata Kshaya. According to Ayurveda, treatment is only done for dosha Vruddhi. Dosha Vruddhi, the manifestations of Vata Vruddhi. If you want, you can also memorize its shlok. That is Karshya Karshnya, Ushna Kamita, Kampa Anaha, Shakrut Grahan, Bala Nidra Indriya Bhramsha, Pralab Brahmadinataha. Ashtangruda Sutrasthan. Now, first symptom is Karsha. It means weight loss. When a person undergoes excessive weight loss, even though they are taking a proper diet, that is Karsha. Now, why is that? Due to excessive light and dryness qualities of Vata. Now, why is that? Due to the excessive Laghu and Ruksha properties of Vata. What are the causes of it? When we do frequent fasting, dieting, taking low calorie diet, excessive physical activities, chronic illnesses, its effects are more wear and tear takes place in all the saptadhatus. Now, to cure this, the patient should take adequate physical and mental rest, high nourishing diet, and herbal combinations like milk with powder of Shatavari Kalpa, which is asparagus. Now, what are its clinical correlation? This happens in malnutrition, hypothyroidism, chronic infections like tuberculosis, sarcopenia in elderly people. Now, its clinical importance is that when a patient is presenting with unexplained weight loss, dryness, constipation, and weakness, it might be due to Vata dominant pathology. Now, for this, Ayurveda emphasizes Brahmana, that is the nourishing therapy. It is a nourishing therapy, and it is given before there is any severe tissue depletion occurs. Second is Karshna, that is black discoloration of the skin. It is caused due to excess dry, that is ruksha, and cold, that is shita properties of Vata. The blood vessels become constricted and the blood is not directly diverted to skin. Due to this, skin color appears as darkened. Now, our normal color of the skin depends on Rakta and Pitta. Now, if due to Vata Vriddhi, this normal function is hampered, this leads to local effect of dark circles around the eyes and universal action, that is darkening of the skin of the whole body. Poorly nourished skin loses its normal luster and then appears dull or dark. Now, its clinical correlation is chronic malnutrition, dehydration, poor peripheral circulation, chronic debilitating illnesses. Its clinical importance is that skin changes often indicate long-standing vata aggression and tissue depletion rather than a primary skin disease. Now, the third symptom is Ushna Kamita, that is the desire for warm things. When we feel cold, we usually like to go towards warm things, or we like to turn on the heater and stay in a warm environment. Now, due to increase in the coldness of Vata dosha, symptoms of eating hot food, wanting to wear warm clothes are seen. When the Shita quality is increased due to Vata Vritti, naturally the patient seeks warmth to balance out the excess cold. Now, its clinical correlation is cold intolerance, elderly individuals, hypothyroidism, and then its clinical importance is that this symptoms helps differentiate Vata disorders from Pitta disorders, where patients usually prefer cool environments. And as we know that in elderly age, Vata dominance is prominent. Kampa, which is the fourth symptom. Kampa means tremor. Excess uncontrolled movement of any part of the body or muscles is called as tremor. It is a natural reaction to balance the excessive cold. For example, when we shiver in cold, it's like minute example of it, or like less severe example of it, but tremors are are like excessive symptom of it due to mobile property of the vata or the chala property of vata. Treatment is warm, gentle oil application that can reduce tremor. Now, the chala guna vata becomes excessive. That leads to involuntary movements because vata controls neuromuscular activity. That leads to excess tremors, or like excess of vata. That leads to tremors. And its clinical correlation is Parkinson's disease, essential tremor, anxiety disorders, hyperthyroidism. Its clinical importance is one of the most important signs of Vata aggression. Many neurological disorders present with tremors due to disturbed nerve impulse transmission. This is its clinical importance. Anaha, that is bulging of the abdomen or abdominal distension. This is caused due to the increase in ruksha quality of Vata dosha. Effect is abdominal distension due to the accumulation of Vata in Pakvasya, that is large intestine. As movement of Pakvasya doesn't happen, that is the large intestine's mass peristalsis doesn't happen, and then Purusha and Vayu are accumulated and not excreted. Not necessarily the mass peristalsis, but the usual movement of Pakvasya doesn't happen, and Purusha and Vayu are accumulated and not excreted. Now, why does this happen? The Apana Vata regulates bowel movements. When that is aggravated, its movement becomes irregular. Dryness hardens the stool and gas gets trapped, causing abdominal distension. Now, its clinical correlation is functional constipation, irritable bowel syndrome, intestinal gas retention, and its clinical importance is untreated anaha can progress to chronic constipation, abdominal pain, and impaired digestion. Next is Balabhransha. Balabhransha is caused due to increase in Ruksha, Khara, Vishada qualities of Vata Dosha. Its effect is Dhatu Kshaya. The Mamsa Dhatu becomes more weak and a person can't do physical strenuous work. Now, since there is depletion of nutrition, it's clear that the Mamsa Dhatu will become more weak, and when there is less strength, the person can't do any physical strenuous work. Next is Nidra Bhransha. Nidra Bhransha. Cause is Laghu Ruksha qualities of Vata become excess, and then the strength of the person lowers down. This leads to excess Chalam activity of Vata, and that causes disturb in sleep cycle. When a person has a lot on their mind, they obviously cannot sleep, and a lot of the times we cannot sleep also because we have less strength, or we have a lot of thoughts, and that's why sleep disturbance is created. Indriya Bhramsha causes increase in the movement of Vata dosha as well as increase in Rajaguna. Now we know that Vata dosha is Rajagun dominant. Now that's why the effect is concentration of mind and senses decreases. The senses cannot perceive things properly. That is the effect. As we know that Vata governs nerve conduction. Excessive dryness and degeneration impair the transmission of sensory impulses, reducing the function of the sense organs. Now, the clinical correlation is peripheral neuropathy, in which the peripheral nerves are damaged, age-related degeneration in vision, hearing, diabetic neuropathy, sensory nerve disorders. Its clinical importance is that patients may complain of diminished hearing, vision, touch, or altered sensation. That is indicating possible neurodegenerative changes. Next is pralap, delirium or irrelevant talk. The cause is hyperactivity of vata. Speaking is a function of vata dosha. Effect is patient talks a lot due to vata vritti and there is loss of control over their speech. Now, how does Vata cause it? Vata governs speech and higher nervous system activity. Aggravated Vata disturbs mental coordination, resulting in incoherent or excessive speech. Its clinical correlation, its clinical correlation is delirium, mania, acute confusional states, high fever with altered sensorium. Its clinical importance, this may indicate that the central nervous system is involved and requires careful assessment. Next is Brahma. It is giddiness. Its cause is excess chala and lagu property of Vata. Its effect is dizziness due to the deficiency of body strength. Its treatment is tonic, nourishing, and smoothing diet and adequate rest. Now, how does Vata cause it? Vata disturbance affects balance, circulation, and neural coordination. That leads to dizziness. Now, clinical correlation is vertigo, orthostatic hypotension, anemia, dehydration. Its clinical importance: persistence persistent dizziness should always be evaluated because it may indicate neurological or cardiovascular disease. Next is Shakrutgrahan, constipation. Cause is increase in the Ruksha and Shita qualities of Vata. Fluid in Purusha is absorbed in excess and Purish becomes hard. An obstruction to intestinal peristalsis is created. Treatment is 1 cup of warm milk with 1 spoon of ghee at night. Now, how does Vata cause it? Dryness removes moisture from the stool due to the Ruksha quality of Vata. While disturbed upon Vata slows bowel movement, producing hard stools. Its clinical correlation is chronic constipation, irritable bowel syndrome, drug induced constipation, constipation in the elderly, and its clinical importance. Constipation itself further aggravates Vata, creating a vicious cycle if left untreated. Now Vata Kshaya, that is the hypoactivity of Vata. Its shlok Lingakshine Anile Angasya Sadhu Alpam Bhashite Hitam Ashtangruda Sutrasad. It's one of the important shlokas. Angasada. Cause is Chala and Laghu qualities of Vata are decreased in the body parts. So hence Guru Gun increases. Its effect is that it feels like loss of power of body becomes heavy, body's movements slow down, body parts aren't motivated to move. This leads to Angasada symptom. Now how does Vata cause it? Vata initiates muscle contraction and voluntary movement. Muscle contraction and voluntary movement. When its functional activity decreases, movement becomes weak and sluggish. Its clinical correlation is muscle weakness, neuromuscular disorders, chronic fatigue syndrome, peripheral nerve lesions. Clinical importance is that patients experience difficulty in performing routine activities because the muscle power is reduced. Even normal day-to-day life functions and activities feel like a lot. Second is Alpabhashita, that is speaks less. The cause is that Vata stimulation for speech reduces. There is lack of motivation to speak due to Vatakshay. Effect is that there is less desire to talk, the patient speaks very little. Now how does Vata cause it? Speech depends on the normal functioning of Udanavad. Reduced Udanavad leads to a weak, slow, low volume voice. Clinical correlation: vocal cord weakness, bulbar palsy, neurological disorders, general debility. Clinical importance: speech changes may indicate impairment of neurological or respiratory function. Now, these are the symptoms of Vatakshaya in Sushruta Samhita. Vatakshaya mandacheshta अल्पवाक अप्रहर्ष मूढ़संज्ञता च mandacheshta slowness of body movement due to kshaya of chalagun. Alpavaka, patient speaks very little. Apraharsha, lack of enthusiasm and increase in laziness. Vata works as energy. Mudasajnata, senses become unable to perceive their subject due to decrease in quality and quantity of Vata dosha. The chain of Atma, mind and sense subject like Indriya Mana and Atma, the chain is not connected and Mudasajnata symptom, that is ignorance of the connection, arises. Normal functions of Vata dosha do not happen in Vata Kshaya. Now, how does Manda Cheshta is caused by Vata Kshaya? Vata is responsible for all body movements. Reduced Vata function decreases motor activity. Its clinical correlation is Parkinsonism and stroke, motor neuron disorders. Clinical importance is that this symptom helps identify disorders affecting the motor control. There is a simple way to remember the difference between Vata Vruddhi and Vata Kshaya. In Vata Vruddhi, there is excessive movement plus dryness plus degeneration. Now let me write it down here. In Vata Vruddhi, there is excessive movement plus dryness, excessive dryness plus excessive degeneration. And the symptoms are tremors, constipation, weight loss, stiffness, bone pain, and in Vata Kshaya there is reduced movement, plus there is weakness in body and reduced nerve function. Now the symptoms are weak speech, weak muscles, slow movements, and reduced sensation. Now this distinction will help us understand the Vata influence on both hyperfunctional activity and hypofunctional activity and its clinical states. Now the Ayurvedic thoughts on dosha kshaya. Now, as I mentioned above, that in Ayurveda only dosha vritti is considered. Now, why is that? Since Ayurveda doesn't accept abhav, that is non-existence, as padarth, so when there is dosha kshaya of one substance, the another substance is present. That whenever there is vata dosha kshaya, there is kapha dosha vritti, and whenever there is decrease in lagugun, there is always presence of its opposite, that is gurugun. Now, the general management of vata dosha. Now it will be according to Samanya Vishesh Siddhanta. Whenever there is decrease in Lagu Gun, there is Vata Kshaya, we want to bring it back to normalcy. There will be increase of Lagu Gun by Samanya Siddhanta. Now whenever there is increase in Lagu Gun, we will bring it back to normalcy by increase in Guru Gun, which is the Vishesha Siddhanta. Then Vata Vruddhi can be handled by diet, medicines of opposite qualities of Vata. Now what is a proper diet in Vata Vruddhi? The person should have Ushna Snigdha diet, Ahar, Madhur Amla Lavan Rasa dominant food, as we know that it leads to decrease in Vata or Vataksha. Lemon, milk curd, padwar like dorka, okra, that is bhendi, pomegranate, mango, papaya, etc. All this should be included in the diet. Ushna Padarthas like pepper, garlic, ginger, etc. should be added in the diet. Proper lifestyle in Vata Vriddhi should be mental and physical relaxation, abhyanga, that is oil massage, especially sesame oil is the best, it is Vata Kshamak. Then pranayam, that is the breathing exercise in balancing Vata dosha. All of these are helpful.